Ma'am, live enabled on YouTube itself.
Thank you. Please give me that YouTube link.
Yes, ma'am. I'm copying.
So hi guys. Audio and visual, everything okay?
Yes, ma'am.
Okay. So can you please announce in the group that we are doing a live session here?
Yes, ma'am. I'm pasting the message to you and students.
Not me. I am already there. Please post it to students.
Okay. Okay. Okay.
So can you please announce in the group that we are doing a live session here?
Yes, ma'am. Done, ma'am. Done. Already done. People are done. And students.
Not me. I am already there. Please post it to students.
Okay. Okay.
So hello everyone. Yes. We'll wait for 2 seconds for more students to join in. Hello Amin.
Good to go, ma'am.
Okay. Okay. Hi guys. Wait. Okay. So hi guys. I'm just waiting for a few more students to join in so that we can start with this. I'm not able to have my picture here. I don't know why my video
Ma'am,
is not.
please. Yeah, please accept it, ma'am. I have sent a request.
It's not there. Yeah, I have closed it now. Can you close your logo is coming actually. You have to close that. I think then my will come. Your photo is coming actually. Can you please remove yours?
Yes, ma'am.
I think so.
Ma'am, there's a request from my end. Just accept it, ma'am, once.
Yeah, I can't see any request.
Second device.
Yeah, it's
I
not
requested for the start video. Host is
this.
asking for video.
एक
Yes,
minute.
ma'am.
Okay.
Okay, karo, ma'am.
Okay. Done it. But is it coming? No, it's not coming. No, it's the other device. We don't want that device. We want
Yeah,
other
I am
device.
asking for the second device.
Yes. Yeah. Now it will come.
Okay, ma'am. Just wait, ma'am.
Still it is not coming. Your video is becoming the predominant video. You have to remove yours, make my predominant.
Yeah, one second. Yeah, ma'am. Just wait. Just wait.
Anyhow, we'll start, students, because everybody is waiting. So let's quickly
Please start.
start.
Please start, ma'am.
Okay, so this is basically competency PA 22.4, guys. This is necrosis, and all of you know that. Okay, so necrosis is a very, very important competency, and it is a long answer question. It is an essay question that comes in your exam. So this is one part which everybody should be very clear about. Okay, so now once we are clear with this, let's see what are the questions which are asked in this. So actually, in your CBME curriculum, it is PA 2.4. Okay, whereas this is also asked as a long answer question many times, in which it is defined the necrosis, discuss in details about the morphology of the necrotic cells and pattern of tissue necrosis. So these are the questions that is asked. So let us see. Let me ask you a question first. Okay, so let me see how many of you can answer this. Please feel free to comment in the comments here. Okay, so this is a case-based question. Okay, so that's how the long answer questions come in exam. Okay, so this is a 56-year-old female, 56-year-old male who presented with a retrosternal pain. He took antacids without any relief. Meanwhile, his friend suggested him to go to the hospital, where a test was done. And 3 hours was passed. He was still feeling discomfortable. ECG was quickly requested. In the meantime, the hospital people did this test. Okay, so what is this test going to detect? What do you think is this test? Anybody? Can you answer this, please? What do you think is this test going to detect? Come on, guys. Yes. So this test is basically going to detect what? This is TROP-T test. Yes. So hi Shri Harsh. So this is a TROP-T test, everybody should know. Okay. So whenever we have necrosis of the tissue, so the hallmark, the characteristic feature of necrosis is that the cell membranes are damaged. And whenever the cell membranes are damaged, enzymes do come out. Okay. So enzymes leak. So these enzymes are detected in the blood. So that is the characteristic feature here. Okay, so that is what you have to know this. Okay, so this TROP-T is released whenever the cell membranes are damaged. Okay, so coming to the next question. So 26-year-old male presented with jaundice, and his hemoglobin was 6 gram per deciliter, and he complained of abdominal discomfort. And in first scenario, we saw that his transaminases were raised. In the second scenario, we saw that his alkaline phosphatases were raised. So what are we looking at? What is this case looking at? So whenever we have a liver injury, in that cases the transaminases are raised. Whenever we have a gallbladder injury or a bile duct injury, okay, so bile duct injury will release alkaline phosphatase. So that is the typical thing that everybody has to remember. Okay. So these all indicate that whenever the cell membranes are damaged due to necrosis, then these enzymes are released in the blood, which can be detected by various tests, and they help us in our diagnosis. Okay. Now this is another test. Can anybody tell me what is this specimen? Anybody can tell me what is this specimen? What is it? Come on. This is a slice of the heart. Okay. So whenever we take this section of the heart, we cut it as slices. So this is a slice of the heart. Okay, so in the slice of the heart, what catches your eye, that there is some red area and there is some white area, isn't it? So some red area and some white area. So what is happening is that this is a case of myocardial infarction, and we have put a dye. Okay, so this dye we will study in the cardiology when we study CVS. So this is triphenyl tetrazolium chloride. This is TTC, which binds with the LDH. So it has a very high affinity with LDH. So whenever it binds with the LDH, it gives the red color. It gives the red color. But when the cell membranes are damaged, the LDH leaks out and that area doesn't take color. So can you see? So this area of the heart is not taking any color. So what is this? This is a necrosed area. So can you see this necrosed area is pale? So that is very characteristic feature. Necrosed area is pale here. Whereas can you see this area? It is a red area. So this means this is an intact area. So here LDH is inside the cell membranes. Okay, inside the cell membranes. So that is why when it is inside the cell membrane, it is taking that red color. It is taking that red color. Okay, whereas this white area which you are seeing, okay, so this white area which you're seeing is actually pale area. Why it is pale area? Because obviously there is no LDH in this. Okay, so that is the characteristic feature here. Okay guys, so that is what we have to know in this. Okay, now once we are very clear with this, okay, so once we are clear with this, I am sorry guys, my image is not coming. I can see that in comments. I don't know how it is not coming. There is some issue. I think it's not coming. Yeah, we can't do anything. I think it's not some glitch today. Because of that, the image is not coming. So I don't know. Anyhow, so I hope everybody is clear with this. So whenever the cell is necrosed, cell membranes are necrosed, that means the enzymes leak out, and these can be either detected in the blood, or you can even put stains to identify whether the cell membrane has the enzyme or not. Okay. So can you see this? So whenever the heart whenever we have a heart attack, MI, okay, whenever the cell membranes are damaged, so the enzymes come out, which we can detect in the peripheral blood. Similarly, in the liver, when the liver is damaged, then transaminases like SGOT and SGPT come out, which we can detect in the blood. Whereas when the bile duct is damaged, alkaline phosphatase can come out and it will be detected in the blood. Okay. So now let's come to how to write a long essay question. So whenever we have an essay question given to you, always remember you have to follow some patterns. So every part in the essay question has marks. So first thing that you should always try to write as definition. If you know the definition of that entity, very good, write the definition. That will give you good marks. Second thing that you should write always is etiology. Okay, so if you know the cause of it, write down the etiology. And then etiology should be followed by pathogenesis. So if you know the pathogenesis, please write the pathogenesis. Then after that, you have to write any types, if any. Okay, so everything in pathology can be subdivided into types. So do write the types also. So that will give you a lot of score. And after that, you can write the clinical features if you have clinical features, and then the diagnosis. So whenever you have to score good marks in the essay question, you have to divide the question into various headings. So always write definition, etiology, pathogenesis, types, clinical feature, and diagnosis. And if there is something in which prognosis is there, do write about the prognosis also. That will also give you a score. So every point in your essay every essay question has marks. So always divide and write it, and that will give you a lot of score. So now let's come to the first is, what is the definition of necrosis? So necrosis, what do you think is necrosis? Necrosis, can I write that necrosis? Okay, so name itself says necrosis. Necrosis means it is a irreversible injury. It is a irreversible injury, or you can write it is a cell death. Okay. So first you have to write what is this. Okay, so first whenever you have to write a definition, always make sure you know what is this entity. So it is a cell death. Okay, cell death. Why does it occur? Due to, so why does it occur? So that is the next question that you should write. It occurs due to, cell death occurs due to variable causes. Due to variable causes. And what is it characterized by? Characterized by, you have to write what is characterized by membrane damage. There is always associated with membrane damage, inflammation, and enzymatic degradation of the cell. Enzymatic degradation of the cell. Okay, so if you remember these points, it will be enough. Variable causes. What is the causes you can write? Variable causes like hypoxia, chemicals, or infections. So that will complete your definition. So you've read, whenever you have to write the definition, always make sure first you write down what is that disease. What is that disease? Why does it happen? So due to what causes, and what is the characteristic feature of that disease? So whenever you have to write a definition, you needn't mug it up. Okay, so just remember you have to write what is it, what is the cause, and what are the characteristic features, and that will define your answer. Okay, so now let's see how does it happen. Just a point of concept. So I've already given this PDF to all of you. All of you know that we have, okay, so let us, I'm just that it is already given to you. You don't need to write anything, it's already given. So this is your cell. Cell is like a miniature human being itself. So the most common cause of cell death is hypoxia. Okay, so that hypoxia could be due to ischemia or anemia or cardiorespiratory causes. Whenever the oxygen levels fall down, you know, oxygen is very important for maintaining oxidative phosphorylation. Okay, so that is the main function why we need oxygen, is for oxidative phosphorylation, and this creates ATP. This creates ATP. So we should have sodium, potassium, ATPase pumps which should work. Okay, so all of you know that sodium, potassium, ATPase pump kya karta hai? It sends out 3 sodium and it pumps in 2 potassium. So 2 potassium will come in, okay, and 3 sodium will go out. 3 sodiums will go out. So what happens whenever we get hypoxia? Okay, so there's no oxygen, so automatically the oxidative phosphorylation stops. Automatically the sodium, potassium, ATPase pump stops. So obviously this pump will stop, so sodium will not be pumped out and it will start collecting in the cell only. Obviously, you know, wherever there is sodium, there is water. So this cell will start showing swelling, isn't it? So the first morphological change of any cell which gets injury is cellular swelling. So cell starts undergoing swelling. Now it is swelling. So not only the cell is swelling, everything is swelling, isn't it? So, you know, every cell on the outside have small microvilli. Okay. So when cell swells, just like a balloon, imagine when you're putting a lot of air inside the balloon. So what is going to happen is this cell, when it swells, the microvilli are lost. And not only microvilli are lost, there is also formation of blebs. So there's so much water that it starts forming blebs. So can I say on the outer surface, what are the features of the reversible injury? Because this also can be asked as a short answer. So there is loss of microvilli, there are bleb formations, and there are swellings. Okay, so these are 3 characteristic outside features which you can see on the outer surface of the cell. Now what happens inside also? All the organelles are also swelling. So there is swelling of the mitochondria, there is swelling of the endoplasmic reticulum. Okay, so all the organelles are getting swollen. Now, do you know which is that organelle which has 2 subunits? So if they swell, they will get separated. So which is that organelle which has 2 subunits? Ribosomes. Very good. So whenever the ribosomes are swollen, these ribosomes get separated. These ribosomes get separated. So what is going to happen is protein synthesis is going to go down. Protein synthesis is going to go down. Obviously, when the protein synthesis decreases, compensatorily some fatty change starts. So this fatty change is another morphological feature of reversible injury. So we had cellular swelling which happened first. After cellular swelling, we have so much swelling everywhere, and after that we got ribosomes which got separated, and then we got a fatty change. So that is a very characteristic feature which you will see in cases of reversible cell injury. Now, one more feature that you have to remember is, see, when oxidative phosphorylation is not occurring, obviously the body will change into alternative mode of respiration, isn't it? So what is the alternative mode of respiration? It is glycolysis. It is glycolysis. So whenever the glycolysis occurs, there are 2 things which is going to happen. One, okay, so glycolysis is occurring. So the end product of glycolysis is lactic acid. Okay, so there's a lot of lactic acid which is being produced, which is actually your H ions which are increased. Now these H ions, what do? Is they cause mild chromatin condensation. Okay, so normally let us say the nucleus was this big. But what happens here is the chromatin, the nucleus becomes little condensed. Okay, so whenever we have acidity, it causes condensation of the nucleus, which you can see here. So there is condensation of the nucleus, which is going to happen. But this is mild, that is, it is reversible. So this is called mild chromatin condensation. So this is also a very important NEET PG question that is asked in the exam. So mild chromatin condensation is a feature of reversible cell injury. Apart from that, you remember that obviously glycogen is getting used, so the glycogen levels will also go down. Okay, so whenever the glycogen keeps on becoming lesser and lesser and lesser and lesser, this gives a glassy appearance to the cell. So more low, when the glycogen completely finishes, then the cell will become very glassy. Okay, so glassy appearance in the cell, okay, like a glass, homogenized, it is due to loss of glycogen. Okay, so that is there. Now what is going to happen is, so once you're very clear with this, so this is the main thing which is reversible. Now, when does a reversible injury becomes irreversible? Till what time the cell is going to keep on swelling, 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 swelling? One time will come when the cell membranes will rupture. So one time will come when the cell membrane is rupture. This is the hallmark of irreversible injury, that is necrosis. So what is the hallmark of necrosis? If somebody asks you what is the hallmark of necrosis, it is membrane damage. Okay, so once the membrane damage occurs, this is the hallmark of necrosis. Obviously, when the membranes are damaged, just now you saw all the enzymes are going to come out, isn't it? All the enzymes are going to come out, which you will be detecting in the blood. Not only that, what happens, what comes inside is also important, not only what goes out. Okay, so there are two things which come inside. One is the calcium. Okay, so first, the molecule that will come inside will be calcium. This calcium is going to activate PAPE group of enzymes. So what enzymes it is going to activate? PAPE group of enzymes. So what is this PAPE? You should remember P for phospholipase. Okay, phospholipase. Okay, so phospholipase, that means this is phospholipase, some enzyme. Whenever there is a ACE behind any enzyme, that means that enzyme breaks that component. So phospholipase is one which breaks the phospholipid. Okay, so it breaks the phospholipid. So phospholipids are broken down. You know, everything started because membranes are damaged. So membranes are made up of phospholipids and protein. So more membrane damage will occur. So obviously this process will become irreversible. Now nobody can reverse it. Also, breaking of the phospholipid forms some whorls, okay, which can be seen in the cytoplasm. So these whorls which are seen in the cytoplasm are called as myelin figures. So lot of myelin figures will be seen in necrosis. Okay, so you will be seeing a lot of myelin figures. So how do you see them? It is well seen with electron microscopy. So you can see it very beautifully with electron microscopy. Now the second enzyme that is activated is ATPases. You know that. So this is the enzyme which breaks the ATP. So obviously there is, earlier also there was no ATP. That is why everything started. No ATP means no injury. Now third enzyme is protease. So this protease breaks the proteins. So when proteins are broken down, so number one, membrane will be damaged. Number two, whole of the cytoskeletal will collapse. So this is cytoskeletal collapse. So cytoskeleton collapse will occur. So this will be cytoskeleton collapse. Okay. Now the next enzyme that is activated from E is very important. This is called as endonuclease. Okay, so remember to draw as many flow charts as possible because that is going to give you lots and lots of scores. Okay, so once the endonuclease is activated, that is an enzyme which breaks down the nucleus, DNA and the chromatin. And whenever endonuclease breaks the cell, it breaks in 3 stages. First, it causes marked chromatin condensation. You know, mild chromatin condensation was reversible. Marked means so much condensation that the nucleus appears like a dot. This is what is called as pycnosis. What is this called as? Pycnosis. Now, once the nucleus chromatin becomes so condensed, like it becomes like a dot, after that nucleus has no work to do, the nucleus will get fragmented. So this nucleus is called as karyo and fragmentation is called as rhexis. So you will see karyorhexis. Okay. Now, after that point of time, whole nucleus will completely dissolute. You can't see the nucleus at all. And what is this called as? This is called as karyo. Karyo means nucleus and lysis. So lysis of the nucleus. So definitely endonuclease breaks down the cell nucleus into 3 stages. In 3 stages, pycnosis, karyorrhexis, and karyolysis. So is everybody clear with this? Now here is the catch point that everybody should remember. In pathology, we have a very beautiful dye which we use. This dye is called as hematoxylin and eosin. Okay, so dye is hematoxylin and eosin. So, eosin has a very strong tendency to bind with proteins. Okay, so eosin has a very strong tendency to bind with proteins, whereas hematoxylin has a very strong tendency to bind with the DNA. Okay, so hematoxylin has a very strong tendency to bind with the DNA and the RNA. Okay, DNA and the RNA. So can you see what is happening in necrosis? The nucleus is getting lost. Okay, it's becoming small, it is lysing. So nucleus is becoming lost. So which color is disappearing? Obviously, you know that hematoxylin is disappearing. Okay, so hematoxylin is disappearing. So blue color is disappearing. So cell will appear more pink in color. Cell is going to appear more pink in color. So any cell which is dying will appear more eosinophilic. Any cell which is dying will become more eosinophilic. So that is the pathogenesis of necrosis. Now, one more thing that happens in necrosis. So if I say what all are happening in necrosis, now let's quickly make a gist of what happens in necrosis. So everything is given in the flow chart, but what happens, let's quickly see. Can I say the hallmark of necrosis is membrane damage? Okay, so that's the hallmark. The hallmark was membrane damage. Okay, so membrane damage was the hallmark. So now what happens when the membranes are damaged? Obviously, which enzyme got in, which molecule got in? Calcium got in, isn't it? Which activated PAPE group of enzyme. And the nucleus, became pycnotic and slowly it completely dissoluted, right? Apart from that, mitochondria is very important organelle which tries to control excess calcium uptake. Okay, so in mitochondria also we get large amorphous densities. So what is the finding which is seen in the mitochondria in cases of necrosis? We see lot of large amorphous densities. So these are large. Okay, so small amorphous densities can be seen even in reversible injury. So these are large amorphous densities which are seen in mitochondria. Okay, so can I say that what are the features on necrosis which you should see and you should write? So what are these findings called as? So we know pathogenesis we have already written above ki membrane damage hui. Okay, so membrane damage se calcium andar aaya, calcium activated PAPE group of enzyme and how it broke the nucleus and everything. Also we have written the pathogenesis, but one more thing that we have to write here is that now once the membranes are damaged, so the mediators come out from the cell. So these enzymes can be detected in the blood, but they will activate inflammatory cells. Okay, so they are the ones which will give signal that, okay, cell is dying, please help the cell. So it will release inflammatory cells. So inflammatory cells will be released. Okay, so depending upon the injury, neutrophils and macrophages will come into action. So there will be a lot of inflammation here. So there will be neutrophils. Okay, there will be macrophages which will come into action. So there will be macrophages and neutrophils which will be coming into action. So whenever the neutrophils and macrophages come into action, okay, another thing that you have to remember is that these neutrophils, okay, when they are attacking the dead cells, so their lysozymes will be released. Okay, so they have lysozymes, isn't it? So lysozymes have their dangerous enzyme which will go inside the cell, and these lysozymes will degrade the cell. It will degrade the cell, and that is how the dead cell is disappearing. Okay, so that is how the dead cell disappears. Okay, so there is lysosomal degradation. Okay, lysosomal degradation of the cells. Okay, so this completes the complete pathogenesis of necrosis. So quickly to revise, who's going to tell me what is the complete pathogenesis of necrosis? Number one, there is membrane damage. Okay, membrane damage will push in calcium. It will activate PAPE group of enzymes. It will lead to formation of large amorphous densities, and endonucleases causes pycnosis, karyorrhexis, and karyolysis. Also, membrane damage will attract a lot of inflammatory cells, especially the neutrophils and macrophages, and the lysosomes will go inside and they will degrade the cell. Once you are clear with the morphology of the pathogenesis of it, morphology of the cells become very, very easy. Okay, so somebody asks you what is seen in the morphology of necrosed cell. Okay, so can I say, I'll show you the images also, but if you have to write the morphology of the cells. Okay, so whenever we have to write morphology in the exam, always remember you have to write that morphology of the cell or microscopy of morphology of the cell. Whenever you have to write, so you have to first mention the gross appearance, and then you have to write the microscopic appearance. Okay, so you have to write the gross and the microscopy. So grossly, any dead cell, okay, any dead cell, okay, so most common, we will see, study the types. So most common type of necrosis is coagulative necrosis, and this appears like localized infarct. It appears like localized infarct. So that is the gross appearance. It looks like the localized infarct. Whereas if somebody asks you, what is the microscopic appearance of the necrosis? What is the microscopic appearance of the necrosis? Can I say the cells will appear more pink in color? Number one. Why will they appear more pink in color? Because there is loss of cytoplasmic. Okay, so there is loss of cytoplasmic RNA, because RNA is released from, okay, so there is lysosomal enzymes also there. So RNAs are released. Also the nuclear RNA is also lost. Third, there is protein denaturation. There is a lot of protein denaturation. So eosins bind very strongly to denatured protein. Okay, so eosin binds strongly to the denatured protein. So somebody asks you, what is the cause of pink color of the cytoplasm? So nuclear nahi aayega na, when if I'm asking why the cytoplasm is pink in color. So if I have to see the cytoplasmic findings, so what will I write? There is loss of cytoplasmic RNA and there is denatured protein which binds very strongly with eosin. So these are the 2 points you should write. So why does the cytoplasm appear very pink in color? Because there is loss of cytoplasmic RNA and eosin binds very strongly with the denatured protein. Okay, so these are the cytoplasmic finding. Now all of you know that what happens. Let's come to the image that was given to you. Okay, so this was the chart that was given to you. So can you see what is the cytoplasmic changes which are seen in necrosed cell? So all the cells appear very pink in color. Okay, so which organ is this? So can you make out which organ is this? Yes, you can see this glomerulus intact here. So this is a kidney. So you are able to see the outlines of the cell, but the cell has become very pink in color. So can I say the cytoplasmic changes, the cell is very pink in color? Number one. However, the outlines of the cells are maintained for some time. Okay, outlines of the cells are maintained for some time. So you can identify the organ. You can identify the organ. Okay, so this is also called as tombstone appearance. Okay, so what is this called as? Tombstone appearance, as if it is standing tombstones. Outlines are intact. That is what you can see in the cytoplasm. Now, all of you know that after the, what is the end product? Lysozymes get inside the cell and they completely eat the cell. So can you see this is pink, but there are a lot of vacuoles coming here. So what is this appearance called? This is called moth-eaten appearance. What is this appearance called? Moth-eaten appearance. So this is moth-eaten appearance. So that is the third appearance. So if somebody asks you, what are the cytoplasmic changes of the cell? Can I say the cell is very pink in color? However, the outlines of the cell are maintained. This we are talking about the most common type of necrosis, that is coagulative necrosis. And after a point of time, the cell becomes moth-eaten. Okay, so this is very characteristic that you have to read right. But cell सिर्फ cytoplasm तो नहीं होता, nucleus भी होता है. तो इसीलिए let's come to the nuclear changes in necrosis. So you all know, we have already studied what are the nuclear changes in the necrosis. First, the nucleus becomes very small, like a dot. This is called as pycnosis. Then there is fragmentation of the nucleus. This is called as, we have already studied, karyo is nucleus and rhexis is fragmentation. After a point of time, nucleus completely disappears. And what is this? Karyo is nucleus and lysis is complete dissolution of the nucleus. So this is the nuclear findings that you can see. So these are the morphological features of necrosis. So think of the question when I told you how should you attempt the question. So let's see, are you able to write? Okay, so first, everybody, are you clear with the definition of necrosis? Yes, what was the definition? Quickly revise. Definition was, it is a type of cell death due to various causes like hypoxia, chemicals or infections, and they are characterized by, do you see this? What they are characterized by? Membrane damage, inflammation, and enzymatic degradation. And if you remember more, there's one more point you can add here. What? Just now studied denatured proteins. Yes, so denatured proteins are also seen. So they are characterized by denatured proteins also. So that completes your definition. Now everybody is clear with the etiology and pathogenesis. We have started about membrane damage, calcium, enzymes, okay, and how lysosomes get inside. So that was etiology and pathogenesis. Now we want to talk about types of necrosis. It's very simple. So everybody, I've given you two charts, which is the gist of everything, but I'll just explain you that how to study. So just remember, we make a gist chart of all the necrosis together, and we should see them together so that we never forget them. Most common type of necrosis is coagulative necrosis. Okay, so this is the most common type of necrosis, and the hallmark of coagulative necrosis is, so you should always draw flowchart and table. So the hallmark of coagulative necrosis is protein denaturation. Okay, so this is protein denaturation. That's the hallmark. Okay, so this is the hallmark. Okay, protein denaturation. And what happens? This is the most common type of necrosis. And what have you seen? Cells appear more pink in color. Outlines of the cell are still maintained. Okay, they appear like tombstones. Okay, so that is what we have studied in coagulative necrosis. Okay, so now the nucleus is lost. You have already studied the nucleus of the cell is lost because karyorrhexis and karyolysis. Nuclei is lost, and of course there is inflammation. So these are the morphological features of coagulative necrosis. Done. Now, in contrast to the coagulative necrosis, the second type of necrosis that you have to study is liquefactive necrosis. Please remember, it is opposite of coagulative necrosis. Name itself says liquefactive necrosis. It's liquefied. So this is because it occurs because of enzymatic action more. Okay, so enzymatic action is the last action that is going to happen, but that action is predominantly seen in liquefactive necrosis, and this kind of necrosis is seen in brain. So what happens in this, when the enzymes act, it is completely destroyed. So whole of the tissue is dissoluted. So there is dissolution of the tissue. Okay, dissolution of the tissue. So you can all see this is in the flow chart that I've already given you in the table. So there is dissolution of the tissue that is seen. Okay, so that is very characteristic of liquefactive necrosis. Okay, now there is a term which is called as gangrene. Okay, so please remember, gangrene is nothing but it is necrosis with putrefaction. So whenever there is putrefaction with necrosis, it is gangrene. And we have dry gangrene and we have wet gangrene. So what is the difference? Remember, dry gangrene is usually a type of coagulative necrosis with putrefaction. So whenever the coagulative necrosis undergoes putrefaction, it is dry. Whenever the liquefactive necrosis, okay, so whenever the liquefactive necrosis undergoes putrefaction, it is wet gangrene. Okay. Also, you should remember that dry gangrene usually occurs whenever there is arterial occlusion. Usually whenever there is arterial occlusion. So because of arterial occlusion, the tissue becomes shriveled, complete shriveled. So the border, the outline between the normal and abnormal is well defined. So can I say the demarcation, okay, between affected and normal is, demarcation between affected and normal is well seen, it is present. Whereas in wet gangrene, we have venous as well as arterial circulation. So what happens? This causes a lot of edema. So what happens? You cannot see any demarcation. You cannot see any demarcation between the affected and unaffected area. So let us look at these diagrams of at least these three types of gangrene first, and then we'll go further. So look at the first image here, guys. What do you see? Identify the organ. Learn to identify the organ. What are you seeing? This is a glomerulus and these are the tubules. So what catches your eyes? Is there nucleus in any of these? No, there is no nucleus in any of these. There's loss of nucleus. Number one, cells are appearing more pink in color. Okay. So cells, but you can identify that this is kidney. So this is tombstone appearance, more pink, and the nucleus is lost. Whereas look at the other organ. Again, this is kidney. and the tubules. Okay, but what catches your eye is there is some blue cells here. What are these? Inflammatory cells. Okay, so there are inflammatory cells here. So remember, nucleus is lost in coagulative necrosis. They appear more pink. However, outlines are well seen. Let me show you one more image. Can you see this? Only this part of the tissue you can see pink, and rest they are perfect, and they have the nucleus also, which you can see. So this means there is a well demarcation between normal and dead. Okay, so this is muscle. Okay, so this is the coagulative necrosis of muscle. You know, coagulative necrosis of muscle was called as Zenker's degeneration, and it used to see earlier days in typhoid. अब तो बहुत कम होता है, पर पहले टाइफॉइड में होता था रेक्टस मसल्स में. Now this is not much seen, but hey, this is a very good image to show you demarcation between the normal and abnormal. ठीक है. Now once we clear with this, how does the gross of coagulative necrosis appear? So gross is always a localized dead tissue. This is called as infarct. So what is this called as? Infarct. We'll be studying more about infarct in hemodynamics. Okay, so whenever the tissue is dead, it appears like a wedge-shaped infarct. Okay, now look at this. What is this? This is a liquefactive necrosis. What do you see? Complete tissue is dissoluted. Okay, tissue gayab hi ho gayi hai yahan pe. And here you can just see dissoluted tissue. You can't make out the parent tissue, and there is a lot of inflammation. That's very characteristic of necrosis. Look at one more diagram. So this is characteristic necrosis. So here is a catch point that you should remember. So brain is a one tissue which will undergo extensive amount of liquefactive necrosis. So therefore, when we get an autopsy, pathology usually also deals with the autopsy. So first thing, when a person dies, we should always inject formalin in his brain. You know why? Because brain will quickly undergo liquefactive necrosis. Then you will not be able to identify the changes in the brain. Understood? So you should be injecting formalin immediately after the death in the brain, especially in a child. Okay, immediately he dies, you want to find out the cause of death of a child, immediately inject formalin, and then will preserve the brain. Okay, and look at this. Can you see this gangrene? So I'll show you two gangrenes together. Yes, so one, the outlines are well demarcated. This is dry gangrene. Here there's no demarcation between the normal and abnormal. This is a wet gangrene. So I hope everybody is clear with wet and dry gangrene. Yes, you are clear. Now once we are clear with the three type of necrosis, let's come to some modified type of necrosis which we should know apart from these. So let's come to modified types of what are the various other types. So we have caseous necrosis, we have fat necrosis, and we have fibrinoid necrosis. So these are other three type of necrosis which we should be very clear. Okay, so I've written it together so that you don't do this wrong in your exams, and you should be very clear with this. Okay, so when is caseous necrosis seen? Caseous necrosis is seen whenever we have infection by mycobacteria. Okay, so mycobacteria, especially tuberculosis, has a lot of mycolic acid in them. Okay, so a lot of mycolic acid on them. So this is actually a lot of lipid. So whenever this excess lipid gets deposited in the tissue, then the tissue appear very cheesy. Okay, so this tissue appears very cheesy. It's like a pizza top. Okay, so that's how it appears. This is what is called as caseous necrosis, which is very typically seen in TB. But can it be seen in other conditions? Yes, any organism which has more lipid content can show this, like histoplasma. Okay, so histoplasma will also show you this. Okay, so this should be very clear to everybody. Okay, so caseous material is a granular material. Okay, so granular pink material which is deposited, I'll show you. And whenever it is associated with TB, so TB is type, remember this, whenever we talk about hypersensitivity, it's type 4 hypersensitivity. So it activates T cells, which will activate macrophages to change into epithelioid cell, which we will study more in inflammation. But for now, caseous necrosis is a very cheesy material on gross, and microscopically it appears very granular material, granular pink material. Okay, so we'll see that. Now, what about fat necrosis? Who's dying in fat necrosis? Fat is dying in necrosis, fat necrosis. How is fat dying? So it can occur due to trauma to the fatty tissues. Okay, so whenever we have a trauma to the fatty tissues, okay, so like breast, omentum. Okay, so whenever we have fatty tissue trauma, or whenever we have a dedicated enzymes like lipases, so when these are released, these will break the fat into free fatty acid. And you have studied in your 12th class that free fatty acids can never remain alone. It will bind with calcium to form soaps. So this reaction is called saponification. So that means क्या हमारे पास palmolive soap या Lux soap deposit हो जाता है cell में? No, these soaps appear as chalky white deposits. Okay, so they will be seen as chalky white deposits. So let us see these two because we have to be clear. So one is fat necrosis and one is caseous. So let us see how does they appear on the Gaussian microscopy. Okay, so let's come to first is your caseous necrosis. Okay, so this is your caseous necrosis. First, what is the parent tissue? Always identify the parent tissue. This is lung, and in the lung you are seeing this cheesy yellowish material depositing in the lung. Okay, so this is your typical caseous necrosis. By the way, why is the lung black in color? Because carbon pigment is deposited on it. Okay, so that is why it is black in color. Okay, and can you see this granular pink material which is deposited here? So that is very, very typical. That is very, very typical of caseous necrosis. Okay. Now, let's come to fat necrosis. What do you see in fat necrosis? I told you chalky white deposits. So can everybody identify these chalky white deposits? Okay, so these chalky white deposits are very, very typical. Okay, very, very typical. So either it is due to trauma that these fats are broken into free fatty acid and they bind with calcium. So, I'll tell you a very important story here. Whenever we have fat necrosis of breast, it is usually confused with carcinoma of breast, especially on mammography. Okay, so whenever so we got one case in our practice, and in earlier days, so it's like long back when true cut biopsy was not the norm. So at that time there was a fat necrosis case. Okay, so fat necrosis was there on mammography, and it looked like malignancy. So at that time people didn't had a norm of doing true cut biopsy. So at that time mastectomy was done, and we started searching for lump. We couldn't find lump in that tissue or in that female. It was only these chalky white deposits. So we were dealing with a case of fat necrosis, but accidentally that female had undergone mastectomy. So that was a mistake which was used to happen in earlier days. So that is why now it has become norm that in any breast cancer we should do true cut biopsy. First, we have to biopsially proved that this is a breast cancer. We have to be very sure. We put IHC on that breast cancer and give the typing, and then only we proceed further. That is why true cut biopsy became the norm in the breast cancer diagnosis. Understood? So remember, the point noted here is that fat necrosis cannot be differentiated by malignancy on the radiology. Okay, and can you see this? This is pancreatitis. So in pancreatitis, we have lipases which comes out, which can cause breaking of the fats into fatty acids, and again saponification can occur either in the pancreas or in the peritoneum. So if you see chalky white deposits, you should be very cautious that what is happening is fat necrosis. Okay, so that is your fat necrosis. And now we are left with only one type of necrosis, and that is this. So both of them are similar. So what is this? This is called fibrinoid necrosis. What is this called as? This is called as fibrinoid necrosis. So what is fibrinoid necrosis? Name itself says fibrinoid, like fibrin. Okay, so what happens is, so whenever we talk of about blood vessels, okay, so all the blood vessels are lined by endothelium. Okay, so what happens is either there is malignant hypertension, okay, which damages the endothelium, or we have antigen antibody reaction, or we have antigen antibody reaction. So either we have antigen antibody reaction that deposits in the endothelium, or we have malignant hypertension that damages the endothelium. So whenever the endothelium of the vessel is damaged, so the blood contains a lot of coagulation proteins, especially the fibrinogen. So this fibrinogen like material, these proteins, so this is not only fibrinogen, there are a lot of proteins. So that is why it is called fibrinoid, because it is fibrinogen plus lot of proteins along with the immune complexes deposits in the vessel wall. So this vessel wall, can you see this? So there is a pinkish deposition in the vessel wall which you can see, and of course there's inflammatory cells also, because it's a necrosis. Every necrosis is associated with inflammation. So that you can see some blue nucleus here, that is your inflammatory cells. So that is very characteristic of fibrinoid necrosis. So where do you see it? Either we have malignant hypertension or we have antigen antibody reaction, which is seen either in polyarteritis nodosa, which you will see in vasculitis chapter, or it is seen in Aschoff's nodule, which is seen in rheumatic fever, rheumatic heart disease, or it is seen in Liebman-Sack endocarditis. So Liebman-Sack endocarditis is seen in SLE. Okay, so these are some antigen antibody reactions which can deposit in the vessel wall and can cause fibrinoid necrosis. Okay, so that is fibrinoid necrosis. So that is all the type of necrosis. So I've given you this chart here in the gist chart in your PDF. So everybody quickly, let's revise it. What have you seen? So infarct-like finding on the gross and loss of nucleus in the tubules. So we are looking at coagulative necrosis of kidney, and the main mechanism is protein denaturation, complete dissolution of the tissue, and lot of tissue architecture is lost, only inflammatory cells. So we are looking at liquefactive necrosis of the brain. Okay, the main mechanism is enzymatic action. Okay, looking at the here we have gangrene, which is dry and wet gangrene together. Looking at the lung, we know that cheesy material in the lung with the granular material here, this is caseous necrosis and it is associated with granuloma. So you can later on identify epithelioid cells also. Okay, chalky-like deposits in the fatty tissue, we are looking at fat necrosis, and blood vessel lined by pinkish material here, we are looking at fibrinoid necrosis. So that is the type of necrosis, guys, and that's a chart which you can revise. So that finishes on necrosis competency. So we have discussed all the types, we have discussed the definition, the etiology, the pathogenesis, the types, okay, we have mentioned, okay, and how do we detect them? We have already studied the uses of it also, like enzymes can be detected in the blood for the diagnosis. So that is all about it. So let's have a quick quiz to see how much you have understood. We'll be posting quiz in each of your groups, also in the link below this. So all of you, please attempt the quiz. And that's my Instagram channel. If you have any doubts, please feel free to ask any questions. Okay, so with that, we'll sign off. Hope the session was useful, though there were some technical glitches. I'm so sorry for it, but I'm sure we are going to improve in future. With that, all the very best, guys. Happy learning, and do try attempting the quiz. So I'll be posting the quiz link below this so that you can attempt it. Right, guys? With that, bye-bye. Any other doubts that you have right now, you can ask me. Okay, so I'm going to post the quiz link here. Okay, so I posted the quiz link on the forms and I'm going to post it on the YouTube channel also. So all of you can attempt this. Okay, so I posted the quiz link. Yes, guys, so I posted the quiz link. See it is clickable or not. Otherwise, I'll post it on your WhatsApp groups also. Thank you, Anil. Thank you, Heyman. Thank you, Saeed. Thank you, Anil. Thank you, Muhammad Ali. And thank you, Bhargav. Thank you, Prabhu Teja. Thank you, Zubair. Thank you, Sheikh. Thank you, Monu. Thank you, Pradeep. Thank you, Sharnan, for the comment. I'm so thankful to you. Thank you, Nivedita. Thank you, Besa. Thank you, Nitin. Thank you, World of Movies. Thank you, Nitin. Thank you, Raju. Thank you, Vinay. Thank you, Revant. Thank you, Draw with Kulsum. Thank you, Reshmita. Thank you, Sandeep. So if I've forgotten some names, I'm so sorry. But believe me, I really thank each one of you for attending the session, and I'll be happy if you can answer the quiz which has been posted. Thank you, guys. Thank you. Thank you, Karthik. Thank you, Nitin. Guys, please let me know if you're able to log in into this. Can you attempt the quiz, bacha log? Thank you, Anil. Thank you, Swadesh. Thank you, Suveksha. Thank you, Hafiz. Please see if you can attempt the quiz, guys. If you want me to put this quiz link on my Instagram, I will post there also so that all of you can assess. It's a Google form. I'll be happy if all of you join and just try to attempt the question. So with that, I'll sign off, guys. Yes, bye-bye. Hope you like the session. Do let me know the feedback if you want more sessions like this. Thank you, Sanjay.